Hi, my name's Dr. Bharat Agrawal. I'm a partner and principal at Oasis Dental. I've done a Bachelor of Oral Health in Dental Science, a graduate diploma in Dentistry, a Master's in Aesthetic Dentistry, and a postgraduate diploma in Advanced Aesthetic and Restorative Dentistry. So I did my undergraduate training here on the Gold Coast. I finished that about 11 years ago, and then went on and did a Master's in Aesthetic Dentistry through King's College in London. Also did a postgraduate diploma in Advanced Aesthetic and Restorative Dentistry as well, and fortunately have been able to sort of get involved with teaching now. So I guess I'm super passionate about aesthetic dentistry, and in particular minimally invasive aesthetic dentistry. So for me, my philosophy on aesthetic dentistry is what gets me really excited about it. It's all about helping my patients achieve their aesthetic and dental goals, but doing it in a way that's respectful to their dental tissue, which is so valuable to us. We don't want to be removing tooth structure unnecessarily if we don't have to. And for us, it's then about figuring out ways to combine all of the different tools that we have in our aesthetic toolbox to be able to help deliver those results. So for me, it's about those complex cases where the patient knows what they want and we know what we want to achieve for them, but it's about putting everything together to help them achieve that goal. So I love aesthetic dentistry, and that's what I sort of get most excited about day to day in clinical practice as well. That's a really good question. So I actually did my year 10 work experience with a dentist. So one of my friends at school, his dad was a dentist, and I spent 2 weeks at his dental practice. And for me, that was quite eye-opening. I didn't really quite know what dentistry was all about. I guess I only sort of knew what it was from my own general checkups and things like that over the years. And to be able to see how he was changing his patients' lives, yet sort of just having this incredible connection with his patients, all whilst helping them get healthier, but he kind of just knew everything about them and what was going on. It was more like they were friends and family rather than patients, which is really, really cool. And apart from that, I guess, growing up, I always really liked the sciences, and I really liked art as well. If I wasn't doing dentistry, I'd probably, be doing like photography or something like that. So for me, it was this ultimate combination of both of those things, healthcare, science, but also something that was really creative, that allowed me to use my, my hands and both sides of my brain, which was kind of nice. So that's what still gets me excited about dentistry. It's about creating beautiful things that help people feel better and attain better health. So yeah, it's exciting. I grew up in Melbourne, and I have this, everyone who's grown up in Melbourne have this deep bond to the Melbourne lifestyle. So for me, moving up here and experiencing something different was really quite nice. There's nothing like this anywhere else in the world. The fact that we are 5 minutes from the beach at any given time, really, at any of our practices, I think that's incredible. Just the fact that you can walk out and it feels so different. And just like the people here, everyone's so relaxed. There's nothing to really be upset about up on the Gold Coast living here. Life's good. So it's really nice to sort of see people who are genuinely happy to be sort of going about their day-to-day business. So I started with Oasis back in 2012. So it's been quite an incredible journey. So I started off as an associate at Oasis Dental, and I owe a lot of my clinical expertise and my experience to my time that I spent sort of in those formational years of being a dentist, to the environment that I was in. And I guess for me, when I started Oasis, it was only really myself, David, and Andrew. And the amazing thing was we all sort of felt the same way about dentistry. And up until then, I hadn't really met people who felt the same way about dentistry as I did, which was really nice. Everyone was really passionate about doing the right thing by their patients, but doing it in a way where we were making it comfortable for them, yet delivering excellent results. That was always our priority. And from there, it sort of grew really organically. When we all went into business together after that, it was just about building something that was different to everything else. There was no sort of plan at the start. It was kind of like, let's just do us, and hopefully that'll work, and it kind of has. And I think it comes back to the fact that we don't really think there's any rules on how dental practices should be built, something that hadn't been done before. Our practices needed to smell different, look different, feel different to our patients as well, and creating really an experience that people just hadn't had before in a dental practice. So as far as goals go, there's lots of different facets. You know, I have lots of different goals when it comes to dentistry, and a lot of them relate to our practice and where I want to see that sort of go over the next few years, and just continue to sort of grow that patient experience, be able to deliver more facets of dentistry to our patients as well, and keep up to date with all the changes that are happening in the dental world as far as technology goes and the materials, and keeping up to date with that. So that's a big part of, I guess, the dental practice. One of the exciting things about Oasis Dental is just how big our team has gotten. One of our big goals is helping all of our people find their purpose and continue to help them deliver the kind of dentistry that they want, or be in an environment that makes them sort of conducive to them achieving their goals. So that's a big part of that. And from a dental perspective, you know, I just want to keep getting better and better. I just want to be the best possible dentist that I can be. And a lot of that will sort of come back to me continue to do as much education as I possibly can. And one of my big goals is just to keep being a better mentor to all the other dentists as well. You know, that's a big part of what gives me a lot of purpose and happiness, is seeing them achieve their career goals. So for me, it's about finding that balance and helping them continue to grow and develop that. And that sort of leads on to my teaching goals. You know, we've got a lot of big teaching commitments in the coming years, and continue to develop our courses that we run for different dentists. And the more that I can be involved in shaping the way dentistry is done in the future, the happier I will be as a dentist in 10 to 15 years, knowing that our profession that gives us so much has gone in the direction that we wanted it to go.